Well, hospitals across the country are overwhelmed by a surge in respiratory illnesses, including COVID-19, RSV, and the flu. They're calling this a tripledemic, and it's led to major pediatric bed shortages. So for more on this, I want to bring in Dr. Dyan Hes. She is the medical director at Gramercy Pediatrics. Great to see you. So this sounds like the worst combination. You have a shortage of beds and a spike in respiratory illnesses. Just how seriously is this sort of impacting medical care for kids, I guess?
Well, the problem is that we never had a lot of beds to start with because pediatric cases are the least money-making cases for the hospital. So the hospital is always looking for a reason to eliminate pediatric beds and increase adult beds. So during COVID, a lot of pediatric beds were given up to accommodate those adult patients, and we never got them back. And now we're having all these kids getting flu, RSV. We're really not having that much COVID, at least in New York City. It's really flu and RSV and other viruses, adenovirus, enterovirus. So these kids are getting all these viruses that they haven't been exposed to for 2 years. And then we have no hospital beds now because pediatrics is a low-lying fruit. We make the least money for the hospital. They don't want to keep us in the hospital.
You know, you make a really good point. Like, we brought you on here to talk about this tripledemic, but you also make a really good point that hospitals are businesses that provide a very important service, but all of this factors into the kind of care that we receive. So according to the CDC, flu cases, hospitalizations, and deaths are at a 10-year high. Why is the flu so virulent this year?
I think it's really, one, people aren't getting their flu shots. They need to go out and get their flu shots. That's the biggest thing, number one. Number two, because we have been wearing masks for 2.5 years, a lot of people have been wearing masks, and we have no immunity anymore. We have to expose ourselves. So when I hear New York City talking about reinstating the mask mandate, I think that's the worst thing that can happen because we're just going to prevent the inevitable. At some point, we have to take off the masks and let our population build up their immunity again.
It's so funny because with all of this talk, I thought to myself, because I'm always on the train, I thought maybe I should start masking up again. But you say it's, you know, there's a double-edged sword to that.
I mean, so for 20 years when I was as a pediatrician, I never got sick. And as soon as COVID ended, I got 3 colds in a row.
Wow.
And now I don't wear a mask in my office unless parents ask me, and I say, bring it on. Like, I want to be exposed. You know, like, I don't care if you spit in my face because I need to build up my immunity again. I can't live in a, in a bubble.
Yeah. We're going to run out of time, but just what do you hope as we, first off, what do you expect to happen after Christmas? Because I just thought all these kids are gathering with relatives. Is there going to be sort of an increase, you think?
I think we saw it after Thanksgiving, so maybe it'll be like level off. It's hard to predict because this is all new to us. I mean, we had flu in the summer in New York City, so I really can't predict exactly. I feel like RSV was terrible 2 weeks ago in New York City, and now it's starting to drop a little bit. We really aren't seeing a lot of COVID, and flu has just kind of been steady the whole time. We're also seeing things like Coxsackie virus in the winter, you know, and adenovirus and rhinovirus are making our kids really sick too. So I think it's just time will tell. I feel like I feel like Thanksgiving was the big one, and I don't know how Christmas will be.
And I just want to leave people with a little news they can use. As they are sort of celebrating the holidays, there might be a resistance to take a child to the hospital. Just, you know, when should you make that decision?
And that's a really big one. You don't go to the hospital for fever because you're going to sit there for 6 or 7 hours. Okay. If your child cannot breathe, shortness of breath, if your child's like pulling, you know, above their sternum or between their ribs and having respiratory distress, if your child's dehydrated, if they wear diapers and are not making a wet diaper every 8 hours, if your child has altered mental status from fever, those are reasons to go to the hospital. But to go to get a flu, COVID, or RSV test, you're going to sit in the ER for hours and hours and just take the space of somebody else or catch something.
Right, that's what I was thinking.
So those are the real reasons to go.
All right, Dr. Hes, thank you very much.
Thank you.